the U.S. healthcare system is broken in a lot of ways. I don't think it's focused enough on patient care and what we all need to do to improve, patient care and patient satisfaction, patient outcomes. I think the electronic health record conceptually is a good idea. I mean, medicine tends to lag 10, 15 years behind other industries when it comes to, digitalization. And, we all used to have paper charts when I first practiced. But unfortunately, the utility of the electronic health record, the digital version of your patient's chart, they're often not easy to use on a daily basis, not particularly intuitive, and a lot of time spent clicking on a keyboard and a mouse when we could be having face-to-face time with our patients. And again, because of the rapidity, X number of patients were asked to be seen an hour. It's not possible to give even halfway decent care and do all the charting at the same time. So we tend to take the charts home with us, and I've said this before, pajama time, where we put the kids to bed and then we're still sitting in our bed typing away on our laptop to finish the notes for the day. So it just that work-life integration is just out the window. So I would love to see the healthcare data problem solved, where there was more integration, more user-friendly versions of what we do, and not have the complete onus of that all the charting be the physician's responsibility. Some of the things that don't directly impact patient care could be done by others. But it's a huge problem. I mean, there might be 1,000 different electronic health records that a physician could choose to use, or that a hospital system uses. And I'm on the board of the Health Information Exchange in Nevada, that's trying to tackle this problem to make the ease of data transfer between organizations greater, so that if you end up in an ER somewhere else, you don't have to start all over again with your health history.
And Dr. Pauly, I'll add just a couple of things. There was a hospital system in Indiana, and I wish I could remember specifically which one. But one thing that they did was they brought their IT department together with the physicians to figure out, like, what are some of the most common things that are challenging. And one of them that they found that made a huge difference for clinicians, and it sounds super small, was that they didn't have to type in their password at every computer. They could just have a badge that logged them in and out. And just that simple removal of that they might do 100 times a day made a huge impact for the physicians. So I would say don't underestimate, bringing the two worlds together. I think Dr. Pauly is really pointing to that, and what small solutions might be able to make. Sometimes we're thinking about such a huge system, and it might be like a behemoth to change or to integrate, but there might be small things that make a big impact. And the other thing that I would say is that, one of the things we know, like one of the ways you might notice burnout is charting errors. And so again, this is like, for physicians, a place where if there is burnout happening, it might be one of the first places to have a conversation, like Dr. Pauly said, really having those relationships with the team, and just to check in and make sure someone's doing okay if that's arising.
Yeah. Another thing, a similar story. One of the big hospital systems in San Francisco, at their ER, they said, okay, we want the doctors at the table when we make these IT decisions, because they're the ones that are kind of the end users of what we're using. And then also staffing, like I said, medicine, the margins for keeping your clinic doors open are pretty small right now. And so, if you don't have the right team, I mean, there was a study that came out and said, hey, guess what? If you have 2 medical assistants per doc, you get more done. The patients are happier. They have a person assigned to them for a longer period of time. The doctors, like I say, some of the other, charting things and stuff can be done by more than one person compared to one. I mean, it makes sense why that would happen. But again, convincing an organization to actually hire that second person to staff the clinic, that's a money decision. But there's signs to prove that that's the right decision to make. But again, if you don't have good communication, if you're not paying attention to the factors involved and asking the questions, then the problem is going to continue. When it comes to the individual practice manager that may be listening today, I think having a good relationship with the physicians making the physicians feel like they're involved in some of the administrative decisions when it comes to patient care, work-life balance. I think that open line of communication, I think, is important. And also, the better you get to know your physicians, the more likely you're going to be aware of, like, hey, Quinn fell off the rails. What's going on? He's not acting the same as he did before. You'll be able to notice those things more. So I think just open communication and mutual respect.
So one of the most challenging things for a physician when we offer wellness options is that they then again have to give up some part of their personal life. And so I think when you're really thinking about integrating wellness and wanting to officially support physicians, creating work time, dedicated work time that they could actually take to do that, rather than having it be something in addition to their day, because it is the work that's creating the stress in their life. And so it's like, but somehow the task is on them outside of work then to deal with the stress. So I think that's one way that's really challenging for systems, but really beneficial for physicians.
Yeah. I also think, at least in Nevada, what we're trying to do is, have refrigerator magnet that, has the, Nevada Physician Wellness Coalition.com and the resource line. And so I think if practice managers were aware of what their local resources were and were, repetitively making those resources known to their clinicians, that would be a big step in the right direction.
And I think, Dr. Pauly, you might not be thinking about this because you're that person, but having someone in the institution that's already a wellness champion, like Dr. Pauly was like that before the coalition started. And I think, at least from what I've seen, your colleagues naturally reach out to you. And so having someone in the institution, we found that at every hospital system we go to, is super helpful, and someone that will like immediately, every time Dr. Pauly shares his story, it destigmatizes the issue. And then all of a sudden people start coming out and asking questions like, am I burnout? And can I just connect with you? And so I think, having those people that might already be champions and engaging them is super helpful.
Oftentimes that isn't the case. It's like, in medical school, it's like, hey, you're going to be working long hours and up all night studying for the boards and things. That just suck it up. That's just the way it is. And but we think we're superhuman, but we're not. We're just human. And so sooner or later, those things take their toll. And the same thing is, again, when you're working for someone else, it's like, hey, I don't want to show my vulnerable side because that'll, it'll make me look weak or something. And we're the caregivers. We couldn't possibly be sick ourselves, and we just need to change that mentality. And across the board, even from the patient perspective, realizing that a mutual respect in that department. So there's a lot of work that can be done. There's a lot of work that I think that we're doing already, and I'm proud of the awareness that we're raising to the issue here in Nevada, and the way we've done this completely independent organization. And we're not aligned with any of the hospitals or insurance companies or big groups, we've maintained our independence. We offer our services to those folks, but I think that is going to increase the likelihood that a physician who's struggling is going to reach out. And if another state was asking, what can we do, I would say, well, you can follow our model in that respect, that we kept it independent, because again, the likelihood that a doctor's going to self-report to the board or to the hospital or to someone that's in control of their license or their paycheck is just pretty low.